Hello and welcome to today's podcast. My name is Emelia and I'm joined with Dr. Fiona Schneider, who is a leading consultant gynecologist and women's health expert.
So thank you very much for inviting me to come along. My background is in obstetrics and gynecology. I trained in the UK. I worked in Germany for many years, which gave a different insight into a lot of holistic treatments, especially in terms of menopausal work. And then I've been back in the UK for over 12 years now. And I'm currently just setting up a business on coaching doctors and coaching healthcare workers. So I'm moving into a specialist area with menopause in that business, which I've been doing in my work as well before that.
Okay, during this short podcast, we hope to answer all the questions we commonly hear from patients regarding the menopause. So, what symptoms can women typically expect during the menopause?
So, the most usual symptoms that people have around the menopause, and we talk really more about around the menopause. Strictly speaking, the menopause is the very last period you're ever going to have, and we never know when that's going to be until a year's gone by after the last one. So what is troublesome for women is the time running up to the menopause, and that we call that the perimenopause. So symptoms then are sometimes of irritability, of lack of energy, of hot flushes, sleeplessness. They get bleeding disorders, and there are reasons for that. Sorry.
That's okay.
We'll have to edit something. It's all right. Sorry. I really want my diagram. So what happens with the menopause is that there are two main women's hormones, estrogen and progesterone, that are talked about all through the women's productive life. And what actually happens is that the progesterone level starts to drop off long before the estrogen level does. And so we get an imbalance between those two hormones. And as the progesterone level drops first, around the age of 45 for most women, that gives an exposure to more estrogen. Now, more estrogen thickens the lining of the womb more, and it causes heavier periods. And the progesterone effect that would normally keep that in balance has gone to a lower level and is disappearing. The hot flushes don't appear until the estrogen levels start to drop, probably about 5 years later. And so the perimenopause is over that time. And women get everything really, with every organ really is affected by the menopause and perimenopausal things. So we do know that estrogen affects the brain, so memory is affected. People can get mood and changes, depression, anxiety, mood swings. We know that skin is affected, skin gets dry, vaginal dryness is a problem. We know that painful sex and lack of intimacy is a problem. We also know that bones are affected. Bones can start to get thinner, and we can get joint aches and muscle aches, and general listlessness. So menopause affects virtually every organ in the body.
There are lots of remedies out there which can help manage the symptoms. Which do you recommend?
So what I would say really is that treating the menopause, if you like, is treating by replacing the hormones that are missing. So replacing the estrogen and progesterone, and that must be done through a doctor and through prescription. But there are many remedies on the market that have estrogen-like effects and are available over the counter. So the over-the-counter medicines can be quite potent, and I think it's important to realize that many medicines that are prescribed actually come from plants originally. And the drugs that we would give people as doctors are licensed, tested, and we know the dose. When you buy things over the counter, that may not be the case. I advocate, if people don't want to take hormone replacement therapy, to understand exactly what they're taking. So in the first instance, I'm not a huge fan of combination medicines that have very small amounts of lots and lots of things, because often you don't really know which one you need and which one's treating you. So I'm much more in favor of the purer compounds. So for instance, soya products, and soya has phytoestrogens in them, and they will obviously work in terms of reducing hot flushes. A lot of the patches that we use medically for hormone replacement treatment are made from soya bean these days. So it's not to think that soya bean over the counter is, or soya products over the counter don't have any effect, and they must be balanced as to whether they're right for us or not. Red clover also has phytoestrogens in, which can be quite potent. I'd beware of black cohosh, because that can change liver enzymes, and I would not particularly be in favor of that one. One that can perhaps help you sleep and will help with light depression, and sleeplessness is a real problem for women with the menopause, is St. John's wort. And if you take that in the dosage with pure St. John's wort 3 times a day, some people will complain of increased appetite. I have to say that you have to be careful with it, because it interferes with contraception and other drugs, and is a powerful enzyme inducer, which means that your other drugs may not work as well. So be careful with St. John's wort, but one St. John's wort tablet in full dose at about 8 o'clock at night can work just to relieve sleeplessness and that little bit of feeling of depression without increasing the appetite, and that can sometimes be quite useful.
So what percentage of people take hormone replacement therapy?
That's a very, very big question. I think there are many people that will take it for a short time. It's probably about 50% of women will at least try it at some stage, possibly a little bit higher. If you're talking about GPs and medical doctors who have anything to do with the menopause and treating women with menopause, you'll find a much higher proportion, I would imagine. So they're great believers in it and taking hormone replacement therapy. But a lot of people will try it for a period of their lives when actually they're under a lot of stress, and they really do not need to be going through hot flushes and a lot of the problems that the perimenopause and menopause brings.
And how long can the menopause last?
So when we talk about menopause in this instance, we're really talking about how long does the perimenopause last. And as I was explaining, the progesterone levels start dropping from about 45, maybe a little bit earlier, as the ovaries begin to fail. And that is when the periods start getting heavier, and we can start getting irritability, and that calming effect of progesterone, which is a hormone that's in abundance when we're pregnant and keeps us sort of calm and relaxed, starts falling off. So from about 45-ish, that will happen, and you may not get the hot flushes till you're 50, 52. 52 is the average age for the menopause in the UK, and that might go on for another 5 years after that. It can last as long as that, but it doesn't have to be problematic the whole time, and there are things that can treat it. So I don't want people to go away and think, my giddy aunt, I've got 10 years of problems. With the right treatment and the right course of action, a lot of the symptoms can be really managed very well today. It's not something to be feared.
So you've already touched on this a bit, but what are the links between the menopause and anxiety?
So we know that the estrogen affects the brain, and it has an effect. And when estrogen drops off, it affects the brain. We know that progesterone also affects the brain, because progesterone almost certainly has an effect on appetite centrally. We have poor understanding, I would say, of a lot of it. There's lots and lots of gaps in knowledge. But because that progesterone falls off at about 45, which is the calming hormone, we have a relative excess of estrogen. And the estrogen can make us really quite sort of on edge, a little bit, I don't want to say aggressive, but a bit more wary of things, a bit more snappy. And so that can feed into how our brain reacts and into anxiety, and how we manage those sort of feelings of extra alertness, if you like, with the estrogen, will affect then how we think, how our emotions then come into play. So it's a complicated business of hormones dropping off, but also psychology and how we react to things being managed as well.
So, does hormone replacement therapy have any impact on those kind of symptoms?
Well, absolutely. So a lot of women, when they're in their late 40s, mid to late 40s, when that progesterone first drops off, will be greatly helped by taking progesterone tablets or something like an intrauterine system, where this gives off very low dose progesterone into the uterus. And that can then help calm a lot of the mood swings, a lot of the excess premenstrual tension that some women will have. So that can be used as a form of hormone replacement treatment, sort of in those late 40s ages, perhaps before the estrogen falls off. But when the estrogen falls off and the hot flushes start, then you can add in a topical estrogen. I really do believe that for hormone replacement therapy, the lowest dose of hormone that can be used should be used. And the easiest way to administer hormone replacement therapy is not by an oral mechanism that has to then be metabolized in the liver, but the estrogen can be given through the skin. And for most women, a gel is much easier than a patch because people like to rub their skin with nice creams. So that's easy and it feels pleasant, and you don't have to worry about whether it's going to drop off or not. And an intrauterine system, or there are other ways of giving pessaries also now with progesterone. But an intrauterine system gives a very low dose of hormone and continuously. It doesn't give spikes, highs and lows, and that can help mood as well.
So, if someone is on tamoxifen as a treatment following breast cancer, is there anything that can help with the menopause symptoms?
Well, this is a really difficult one because obviously the tamoxifen is essential after the breast cancer treatment has been successful, and tamoxifen sits on the estrogen receptors, and in most cases it's like an anti-estrogen, which is the thing that can cause breast cancer. And but in certain parts of the body it acts a little bit stimulating like an estrogen, for instance in the uterus. So we can't use drugs that will interfere with that mechanism. So we can't use estrogen or any real form of hormone replacement therapy, except in absolute extreme circumstances where the doctor and the patient have talked this through at length and have taken that risk on board because they've seen that as a necessity for that particular woman. Those are in the NICE guidelines and they're in exceptional cases. And so I wouldn't push for that in any shape or form. Unfortunately, things like the St. John's wort I was saying about, that also interferes with tamoxifen, as do some of the antidepressants that sometimes can be used in the perimenopausal time. There perhaps is one, I wouldn't take any over-the-counter medicines of the black cohosh or red clover or phytoestrogens in soya. Again, those are not to be recommended. There perhaps is some place for a drug that could be used if you have a lot of hot flushes, and that is a drug called clonidine. Again, I would use it very, very cautiously. You'd have to talk to your GP about that. And the interaction isn't so great. What clonidine does, it can stop hot flushes, but it also lowers blood pressure. And there can be a problem with the lowering of the blood pressure too much. And it's certainly not the first line treatment for hot flushes in my book. It's not that effective. So it is very difficult. I think for people that are on tamoxifen and have breast cancer, lifestyle treatments for the menopause are really important. So what I would say, if you're not going to take any other drugs at all, is to make sure that you get good sleep. Now, how do you get good sleep? Well, one thing is not to have alcohol in the evening. Alcohol is a depressant at first, but is a stimulant by about 3 o'clock in the morning, and that gives you bad nights. Sleep in a well ventilated room that's comfortable for you. and also get some exercise. Treat yourself well. No smoking, and try to get the exercise so that you don't the nose weight problems, or as little as possible. So those are the things, and then there may be other ways of well-being, and even talking therapies, cognitive behavioral therapy for anxiety or depression can really, really help people. And so that's what I would do in that situation.
Thank you for taking the time to talk to us today. If listeners at home have any further questions, please contact your GP practice.